Thank you, Commissioner. Um, I got a few things I want to talk about today. A couple of weeks ago, Mr. Peter John provided some information to the public and a warning to the public, and he prefaced that by saying what he was going to say was not politically correct. And I'm going to give the same warning that what I'm about to say on a couple of issues may not be politically correct for some of the progressives in our community. So you may want to turn the TV off or the volume down, because what I'm going to talk about today will include the truth and some facts. And that may be particularly offensive to some members of the Wichita Eagle Editorial Board and others. First, I want to talk now about just say a few comments about the recall effort that happened recently, and the DA has issued a judgment on. I want to say that the response I received from the public was unbelievably and overwhelmingly positive, and I want them to know that I appreciate that I've got their backs, and I know they have mine. I understand that there are many hardworking, tax-paying citizens out there that don't believe illegal aliens should get welfare benefits, and I understand that. I'll continue to fight for you. I also know that you're not racist bigots because of that position, as some would pontificate and say. So, unfortunately, there are people on the left who do things based on emotion and with a lack of the facts and information. And there's been and that brings me really to my main point here. You know, a lot of the things that were talked about in the recall effort had to do with public health and some of the decisions that we've made here in the commission this last year, some of the things that I've supported as well, and even the Eagle opined that some of the decisions that we made were boneheaded. Unfortunately, this whole initiative and many of the things that are being said in the media are factually incorrect. Despite our efforts here at the county to get the information out on numerous times, there continues to be false and misleading information. So I'm going to try one more time to address some of these issues. I know for some it's just not going to matter. For those on the left that are just completely committed to their ideology of big government and creating the nanny state and spending other people's money, the facts aren't going to matter. But I think it's important for myself and the commission as a whole to try and get the truth out there and the facts out there for the general public who may find themselves being misled by what they're hearing in the media. First of all, one of the central allegations with respect to the recall is that we had cut WIC benefits. And we've said this numerous times. There were absolutely zero cuts to any WIC benefits. None of our actions will have any effect on who gets WIC benefits nor how much. In fact, we didn't really cut anything out of WIC. We simply made a decision to spend less on administrative costs than what we were authorized to spend. It was purely about administrative costs. Our assigned caseload has gone down 38% since, I believe, 2010. So we said we are going to control our administrative costs. We still increased the amount we're going to spend on administrative costs from $1.8 million to $1.9 million, so it wasn't a cut at all. It was actually just a modest increase of $100,000, and we decided not to spend more than what we were authorized. We decided to not to spend more than what was necessary. Basic common sense approach. No matter how many times I'm going to say this, I'm sure it won't get through to some people because they won't care, but the facts need to get out there. Okay, we increased the amount of spending on our administrative costs by $100,000, but it will have no effect on WIC benefits whatsoever. Now, I sent an email to the editorial board asking them for specifics, things, and reasons why they thought specific actions that we took were so-called boneheaded or things they didn't like. And they just sent me back links to their opinion page. And I have continued to ask them, give me specific actions and reasons why they think they were bad decisions. They've yet to provide those specifics, because I think the facts would reveal that their opinions aren't based on facts. I mean, everyone's entitled to opinion, but I think at some point we need to grow up and move from opinion to knowledge, and from knowledge to truth. Okay? But you've got to make an effort to find out what the facts are and be honest about it. Some people don't want to do that. And so along that same line, I'm going to talk about a couple things that have come up here recently. There's been a recent article about STD rates climbing in Kansas. There was an article about this, and then there was an editorial about local rise in STD rates here locally. This goes along the same line as false, misleading, and deceptive information that's being put out by various members of the media, particularly in opinion pages, and everyone's entitled to their opinion. But I think there's a clear attempt here to create a narrative that is false and intentionally deceive the public. So let's talk about this. First of all, the original article was talked about the sexually transmitted disease rates have been climbing in Kansas, in the nation, for the last 4 years. All right, fair enough. Came out a report from the CDC. Okay, so write an article about that. That's good. But it's important to remember this has been going on for 4 years. I think the data was up to 2014, but it's nationwide trend. So the article talked about that at the beginning, and at the end it talked about some of the things that some of our people here at Sedgwick County Health Department do. It actually talked about symptoms and treatment. For example, it said that in the causes, it says nationally gay and bisexual men are more at risk, for example, syphilis, because that's one of the things that's gone up nationally. So as HIV. And it says that disease investigators have seen an uptick in people who have anonymous sex, which complicates investigators' ability to track the disease. He said that people have been finding sex partners online through applications, and they meet a person and have sex without even knowing each other's name, and obviously having unprotected sex. And so now they think that may be causing an uptick in some of these diseases. That's fine. That makes sense. All right, very good. But in the middle of this, then, it goes off on this tangent about public health funding. And supposedly some, quote, health experts think that it could be from eroded public health funding. And then it goes on to talk about how the Kansas Health Institute, which we know is not a credible organization, but nevertheless, they give the example of the Community Health Improvement Plan, which was cut out of Sedgwick County for next year. And it's a compilation of data and how bad, this is bad. And even though the expert said he hasn't studied specific effects of public funding cuts on STD rates, it could still be a problem. So we went off on this tangent, but the Eagle didn't fail to include that none of the cuts that we made next year had anything to do with communicable diseases. We have some people that do that. We didn't make any cuts in that area, and that was intentional. But they want to say, think about this. They're trying to give the impression, and I'll get to the editorial as well. Well, actually, let me just go on to this, because the editorial talks about this article, and they did include in it the health officials appoint to anonymous sexual encounters as a trend that makes it difficult and leads an increase of syphilis and HIV, which is happening here locally. But then it goes on that according to some health experts, at least part of the blame goes to the erosion of investment in public health, which is an issue here at Sedgwick County. For example, the $540,000 of cuts that we made in next year's budget. And it talks about the community health assessment, immunizations, cancer screenings, and infant mortality programs. None of which, first of all, have anything to do with sexually transmitted diseases. But second of all, think about this. We're talking about national trends over the last 4 years up to 2014. And you're trying to connect it to reductions in spending that haven't even occurred yet. They don't go into effect until January. So you're trying to give the impression that somehow that's connected. That is absolutely absurd. But I can already see the narrative that's going to be happening over this next year. That's going to be, it's easy for the editorial board to sit up in their ivory tower and pontificate about all these decisions that they made. But if you don't make an effort to get facts and information, you're going to write silly things like this that makes you look completely incompetent. This is not good for our community at all. It's absurd. Now, if all you're interested is your leftist ideology, then I guess it serves its purpose. But think about it. You're trying to give the impression that spending cuts that haven't gone into effect could be linked to STD increases that's happened in the past. Public health funding does not cause syphilis or HIV. Actions by individuals cause you to get syphilis or HIV. If you have sex with an anonymous person unprotected, you're going to get syphilis or HIV. If you're going to participate in certain sexual acts, you're going to be at increased risk, period. That's what causes it. Not proposed funding cuts in programs that aren't related to it and that are going to happen in the future. If you really want to talk about cause and effect, why don't you look at some of the efforts that are going on throughout this country to promote all sorts of sexual behavior as being normal, acceptable, and moral. When you encourage and promote via the media and television, whatever, immoral behavior, you're going to get more of that behavior. And you're going to get more unintended consequences. You're going to get some of those negative effects. So if you want to avoid some of these things, then you don't participate in that behavior. Instead of trying to put the blame on cuts that haven't even taken effect, trying to put the blame on the taxpayer, basically, let's address the real problem. Are you really interested in addressing the problem and individual behaviors, or you just want to cover that up? If you want to have a serious dialogue, then let's have a serious dialogue. But that means you're going to have to put your leftist ideology aside and be willing to accept the facts, the figures, and the truth. Okay. With that, I think I've said enough. And I think it's important for the public to understand, and I hear this from a lot of people, so I know you understand it, that going forward there's going to be continued series of attacks upon this commission for all the good decisions that we make. And you're not going to be told the truth on everything. And we're working with the manager of our communications department to see what we can do to get the truth out and the facts out better. But we can't write the articles. We don't control the media. Some do a good job, some clearly don't. Some have an agenda more than others. But it's important. We have a job to work on behalf of the citizens of this county, and we are, and we will continue to do so. But we also have to do a better job of getting the facts out there so you know the truth of what's going on, regardless of the forces that work against us and attempt to lie and deceive to the public. This is very important. So I'm committed to that fight for as long as I'm in here. No one's going to intimidate me and make me back down, because this is important work, and we'll continue to get it done.